Good afternoon, everybody. Author Sherry Lucille here, interviewing my husband again, who is 9 days outside of his rotator cuff surgery.
Yep.
Yes. And he has some notes and he just has some things he'd like to share with you. So here we go. Way to take it away, John.
All right. Well, since the last video we did, things been progressing pretty well. A couple things I want to review. The reason why I had the surgery in the first place was last December, 3 months ago, I was bench pressing my basement and tore my rotator, had an MRI done. They showed that it was torn completely. Had the surgery, and surgery went very, very well. And since the last video, I noticed a few things I want to kind of pass on. Like, for example, right after the surgery, again, I at home, I had a nerve block put in my arm, and I would encourage anybody who's going to have the surgery to have a nerve block. What it does, it makes your whole side, hand, everything very numb. And for about 24 hours or so. Mine was about 27. And right before it ends, take a little pain medicine just in case. But getting back to myself, I talked to the physical therapist, told him what was going on, and he was shocked that I told him that after the 2 days I was off the pain medicine. No, like I said, I've had zero pain. I'm sleeping in my bed already. I wasn't reclined for about 5 days, and then I stopped it because I tried the bed and it felt right. I even laid on my right side, to my surprise. And so again, and also another thing that I quit using was my ice pack machine. This is something they give you to use and wrap around your shoulder, right here. And about 3 days ago, I quit using that. And again, so I can't complain. About 3 days ago, I started my physical therapy with the therapist, and he gave me some exercises to do so I can get better. But it can be frustrating because just my range of motion is very limited right now. And I don't like that whatsoever. But he says it's going to get better.
What happens when you go outside of your range of motion?
Oh, you go from a 0 in pain to about a 9 or a 10. It just, your shoulder is just very stiff, and they're just trying to loosen things up in there so it will feel better. And like I say, that's another thing. After a couple of days, about 2 days ago, I quit using I still use my sling, but for my physical therapist at home and at the office, I take it off. And matter of fact, I can try to do it right now.
Usually I help him.
And yeah, that's something I was going to notice, that over the last couple of days, I'm becoming more independent. I don't, like for example, when I used to walk down my stairs into my basement, I will very, very gingerly walk down the stairs. I still kind of a little careful, but it's not like the first and second days once I got home after surgery. And so I can take the sling off by myself now. I hope it don't make a liar out of me.
So what I'd like to say while he's getting his sling off as his principal caretaker, so the first 3 days I helped him out quite a bit. And I just never knew how much stuff he did for himself until I had to do it for him. So needless to say, I was very glad the morning I woke up and he was making his own oatmeal, which meant he was really getting back to himself.
Yeah. So then, so here's the sling that they give you. Again, it's basic sling. Well, more. Technically, I'm supposed to wear this for 6 weeks, and it's only been 9 days, but yeah, I mean, my range is very limited, but I do pretty well. I do exercises, but as far as movement, this is it. But I know it's going to get better, so I'm looking forward to the day within the next, couple of weeks, maybe 3 weeks of I can, raise it, not over my head, but close. But yeah, it's been a journey so far, but again, it's only been 9 days. And I'm kind of shocked at myself about how well it was compared to right after surgery. So
So thank you so much for sharing that. I'm sure people out there really appreciate having other people to compare notes with and to commiserate with and to celebrate with.
yes, that's one of the things I noticed that I've watched some of the other videos, and I try to compare myself to other people as far as where I'm at in my recovery. And so, oh, he's kind of there, so maybe I can get close to that. So that's one reason why I want to do this and let you know that it will get better. It's going to take a while, but again, after 9 days, literally.
He could almost fool you with that left arm, thinking that he could do more, but yeah.
Yeah, no pain so far, but no.
Unless he gets out of the range
yeah.
of movement.
Yeah.
Then he has screaming pain.
So anyway, until the next video in a couple of weeks, maybe a month, take care.
Thanks. Bye.
Bye-bye.